So we've talked a little bit about what PSA is all about. We talked about what can affect it. We talked about PSA density. We talked about PSA velocity. And I would like to tell you, you say, okay, what else could we look at? And it's something called free and total PSA, okay? And it was kind of nice. It's like finally somebody got smart enough to say, I wonder if the PSA that comes out of a cancer cell behaves any different than the one that comes out of a normal cell, which was a clever question. And the truth is that they do. Okay, so when you get that number that you usually get, you've been getting for years, PSA of, 5.8, that's the total PSA. That doesn't discriminate where it's coming from, okay? They just go into your blood, they measure, and they say it's whatever number, okay? And then what they found out is that the PSA that comes out of a cancer cell, even though it looks identical to the PSA that comes out of a benign cell, it has the ability to bind another little protein to itself. And a good analogy to that would be like having identical twins dressed identically, which would be a freaking nightmare as a parent, and then one of them always wearing like a little hat on, like a little. The one that has no hat, the one that is free, meaning no proteins bound to it, is called free PSA, and you will hear that term. That's usually associated with benign cells from the prostate. Okay, so that's free PSA. And then the one that it's bound, it's coming from cancer cells. Typically, the way that they report that is via a percentage. And the way they do that is they do free PSA and they divide it by the total. Now we know, since free is the good one because it's coming from benign, the higher that number, the higher the percentage, the better off we are. So people whose free PSA percentage is greater than 25 is fantastic. Very unlikely to ever be associated with cancer. On the other hand, if that percentage goes down to 0, that means none of that PSA is coming out of a benign cell. That's not a good thing. The other tests that are out there that are very helpful, one of them is called PSA3. And PSA3 is nice, in my opinion, because it does not come from the blood. You know how we've been talking all about blood tests? This one comes from prostatic fluid. Okay. What other thing that is really nice about it is that if you ride a bike, it doesn't make any difference. If you have an infection, it doesn't make any difference. So it kind of removes some of those other things that can be touchy and that can make a blood PSA level be difficult to interpret. This one doesn't have any of that. And the way that you do that is you do a rectal exam, which is an important thing to do anyway, to see if you have a bump or not, or whether it's enlarged or soft, or, you look at the consistency. And then on top of that, you massage the prostate, and that will push the fluids from inside the prostate into the urethra. And then you make the patient urinate, and you use the urine as a vehicle to pick up those droplets with that information, and then you send it to be analyzed. Okay? So in reality, it's a urine test, but it's picking up the prostatic fluid.